Here we have 75-year-old female with history of recent onset of left-sided neck swelling. We have got transverse section of the thyroid, trachea in the center, right lobe and the left lobe. Right lobe was normal on the rest of the images, although it looks like hypoechoic on this particular images. You can ignore that. The abnormality was only on the left side. So if we go to the long axis as well as looking at the short axis, I can describe this abnormality as a diffuse enlargement of the left lobe of the thyroid gland, and the normal thyroid tissue is completely replaced by heterogeneous hypoechoic area. The margins are thin and smooth, and the neck vessels are displaced laterally. There is no evidence of involvement of the adjacent strap muscles or extension beyond the thyroid gland. In left level 3, there is a prominent lymph node which has got benign appearance measuring up to 9 millimeter, and similarly in left level 4, there is a benign appearing few lymph nodes measuring up to 8 millimeter. So based on the ultrasound appearances, this lesion can be further graded. A British Thyroid Association grades from U1 to U5, and this particular lesion fits in U5. You can also grade based on the thyroids, where uh, the recommendation will be FNA. So we reported this as a U5 and escalated urgently. Urgent ultrasound guided FNA was performed, which was inconclusive. That is why subsequently we did ultrasound guided biopsy of the thyroid, which we usually do not perform, but in this particular patient, ultrasound guided biopsy was performed and biopsy came back as lymphoma. So one of the differential to consider in diffuse enlargement of the thyroid gland with heterogeneous hypoechogenicity not typical of a thyroid nodule, we need to consider thyroid lymphoma in the differential, although it is rare.